Hi guys, my name is Tiffany and welcome back to the first episode of season 4 of Tiny Tips with Tiff, where I teach you skills in the NICU. So one thing that I get asked from you guys so often is explaining the different levels of NICU. So for those that do not know, the NICU is actually categorized into 4 different levels: level 1, 2, 3, and 4. And each level, depending on the hospital, can care for different types of patients. And so we're gonna kind of go through them all together, and this is what we're gonna be discussing in the first episode. So stay tuned. 'Cause anywhere with you feels right. Anywhere with you feels like Paris in the train. Paris in the train. All right, so before I go on about my spiel about the different types of levels, because I have worked in different levels of NICU in the past, so I'm gonna be sharing with you guys my personal information after I kind of go over some brief overview information that I did find on the American Pediatrics website. So that way you guys can actually get like real information on the differences and then kind of sharing my personal experiences. So I'm gonna be pulling up that information right now on my phone and kind of going through each of them with you. So the American Academy of Pediatrics defines a level 1 NICU as kind of a newborn nursery type of NICU. So basically, level 1 NICUs provides basic care for well newborns and mostly for healthy newborns born close to their due date. So level 1 NICUs usually can care for premature babies and stabilize sick patients, but if they need to have more care, then they will be transferred to a level 2 NICU. So moving on to a level 2 NICU. So the American Pediatrics defines a level 2 NICU as a NICU that provides advanced care to sick newborns or premature babies born 32 weeks or later and weigh more than 1,500 grams or about 3.3 pounds. So level 2 NICUs can care for moderately ill patients where they expect the recovery to be quicker. So services in a level 2 NICU can also include just providing respiratory support, feeding assistant, treating infections. So more like quick things that can be resolved in a few days. But if they also need more higher levels of care, or if they are less than 32 weeks, then they will be transferred to a level 3 NICU. So a level 3 NICU provides care to extremely ill premature patients or newborns or extremely low birth weight patients. These NICUs can also provide a large range of respiratory support, including ventilation, so for patients that are intubated. And they can also have subspecialists of pediatric needs, and they can also stabilize patients that require advanced imaging or complex surgical procedures. Once they do stabilize the patient and the patient does need surgery or any sort of complex needs, then they will be transferred to a level 4 NICU. So level 4 NICU is a NICU that I've worked in for the past 6 years and where I started my career at. So a level 4 NICU is basically the highest level of newborn care. These NICUs can provide care for critically ill newborns, extremely low birth weight patients, premature patients who require advanced complex surgical procedures, including heart surgeries, and babies with congenital heart diseases. They can also provide ECMO as well, which is known as extracorporeal membrane oxygenation. It's a type of care that we can provide to our patients that do need it. And babies that basically need advanced life treatments will go to a level 4 NICU. So that is all defined by the American Pediatrics. And so I'm going to be going over just kind of my experiences on working in these types of levels. So when I was in nursing school, I actually worked in a level 1 NICU where all we really did was care for very basic newborn care. All the patients I care for didn't even require any oxygen needs. Most we've ever dealt with that was more advanced was putting in IVs to do lines and giving IV fluids. We take care of patients that had jaundice and needed phototherapy lights, so we would monitor their bilirubin levels and doing labs on them. But the most that we ever done regarding my skills was we would insert NG/OGs to do feedings because some of these patients are just a little bit premature, and so they're mostly there for feedings and trying to work on their feeds. So that's what we mainly focus on. And then we would just do very quick types of cares that didn't need a lot of treatment. So yeah, the IV fluids, just maintaining them. And then after they're able to stabilize, they usually go back to the parents or they usually would go home really quickly in a few days. So it was very limiting on some of the skills that we were able to do, but we still able to learn a lot just because I have never taken care of a baby in a hospital setting before. So it was definitely a new world for me, and I didn't even know how to do basic newborn care. Like, I grew up with my family where everyone around me was younger than me, and so I grew up taking care of kids, but they were all very, very healthy. And so I knew how to interact with babies and children, but I didn't know how to interact with them in a hospital setting and doing care for them. So I definitely did learn a lot, and learning all the basics of newborn care when I was in nursing school and doing my rotations. And then once I got to my preceptorship, which was my last semester of nursing school, we were able to choose a unit that we wanted to specialize in, and I chose mine to be the NICU, just because I wanted to advance more in my newborn care, learn more about babies and how to treat babies. And so I chose mine in the NICU, and I worked in a level 3 NICU. So when I was in a level 3 NICU, we definitely did a lot more skills for sure. I got to take care of patients on oxygen support. We taking care of patients on high flow nasal cannulas, CPAPs, patients with more IV fluids, IV lines, and IV medications. We did also have patients on a ventilator, not often, but on the unit there would maybe be 1 or 2. And so most of the time I would go to observe those patients, but I did not care for them directly. And so level 3 NICUs are also a great way to advance in more advanced skills. Just because you will be learning a lot, doing more with more critical patients, especially preterm patients, extremely low birth weight patients. Those are the types of patients you're going to be caring for more often. And so that way you get to kind of learn more about how to care for those types of patients, which was really fun and interesting for me. And it really gave me kind of more of a better foundation than I received in my maternity rotation. It was kind of like an advanced level to the level 1 NICU that I was in. And now being in a level 3, we got to see more sick and critical patients, and I did get to advance my skills a little bit more. I didn't get to insert IVs or really deal too much with that, but we did get to work with IV lines and giving IV fluids and things like that. So I was kind of used to that. So when I became an actual registered nurse after passing the NCLEX, I worked in a level 4 NICU, and I've stayed in one since. So I worked in 2 level 4 NICUs now, and so I've definitely advanced on my skills a lot more. And so a lot of people will ask me the differences between a level 3 and the 4, and should they work in a level 3 versus level 4. So I'm going to be telling you guys that really what you're going to see the differences in is the types of patients you're going to be caring for. In a level 4 NICU, I was caring for more complex patients for sure. So the types of patients I would be seeing a lot is like GI issues, patients with metabolic. We've also see patients with genetic complex issues as well as cardiac patients that needed complex heart surgeries. We also had patients on a lot of oxygen support as well. So we take care of extremely low birth weight patients. My smallest patient I've ever taken care of was like a 32-weeker. And you will definitely not be seeing those types of patients in a level 1 or level 2 NICU. And you may see them in a level 3, but a lot of times if they're born that small, they will be transferred to a level 4 NICU. And then once they get a little bit bigger, they may be able to transfer back to level 3 to a hospital closer to home for the families. But yeah, we would definitely see a lot of patients that needed higher oxygenation support, such as being on a ventilator, a jet, oscillators. So those types of patients we would care for quite often. But really the major differences between a level 3 and a 4 is surgeries. What the definition between the differences of the two is the types of surgeries that the hospitals can provide. So a lot of level 4 hospitals can provide these complex surgeries, such as the heart surgeries, lung transplants, heart transplants, things like that, that level 3 hospitals don't have. Level 4 hospitals also have really specialized providers that can provide these types of care. So you're going to be seeing cardiologists, pulmonologists, so really specialized people in level 4s compared to level 3. And then also you'll be seeing in a level 4 ECMO, which is a type of kind of, I call it dialysis for patients for the heart. That way patients that need that kind of care will actually go to level 4. So it all really depends on you, on the different types of NICUs that you want to work with. And it really just depends on the types of skills you want to advance in further into your career. And the question I get asked the most is it possible to transfer to different levels of NICU? Like, for example, you were working in a level 1 and you wanted to work in a level 4, or you're working in a level 2 and you wanted to go to level 3 or 4, or whatever. I'm just going to tell you that it is very possible. You just have to work hard for it. So a lot of hospitals are usually going to require different types of experiences, and it really just depends on the types of levels you've worked in the past. For example, if you worked in a level 1 or level 2 hospital and you want to go to level 3 or 4, they may require you to have more years of experience in a level 1 or 2 to be able to transfer that type of experience into a level 3 or level 4. So for example, if you worked in a level 1 or level 2 and you've been a nurse for at least 3 to 4 years, that may possibly be able to transfer into level 3 or 4, and they're going to be providing you with some orientation and things like that. So if you are working in a level 3 and you want to go to level 4, maybe they will use the requirement of the amount of years of service that you worked as a nurse in order to transfer your skills into level 4, and they'll still provide you training and such. But it's definitely possible. I have seen it before. At my own hospital, we even hired nurses that worked from level 2 hospitals, level 3 hospitals into our level 4 hospital. So it is definitely possible. So it really requires a lot of effort on you to be able to go out there and find those kind of hospitals that will hire you. So you definitely got to put a lot of effort into it. Try to advance on your skills at the hospitals you're working at. So advancing on your skills, maybe taking in more complex roles as well. So if you're doing like resource nurse, triage, being a part of deliveries at your level 1, level 2 hospital, level 3 hospital, and that way they will see that, oh, you have that type of experience, that if you wanted to go to level 3 or level 4, it will definitely give you a higher chance to be able to work in there. Hopefully this video is helpful for you to kind of explain the differences between all 4 levels of NICU, and can also kind of share with you that if you are interested in transferring, is it possible? Yes, it definitely is. Really does require a lot of effort, but it is definitely possible. So hopefully this video is helpful for you. I will see you guys in next week's video, and I hope you guys enjoyed the series. Bye. 'Cause anywhere you feels right, anywhere you feels like Paris in the train, Paris in the train.